The problem of hernia is more common than we might realize, and globally over 20 million hernia repair surgeries are carried out, and it's also said that it's more common amongst men as compared to women. So we are here to unpack all of this today. Otherwise, you're welcome to NTV Medical Matters. My name is Viola Kusasira, and first, before we even further go in, as we have our doctor here ready, we also have a story. We went to the field and spoke to somebody who has experienced hernia. In fact, it has come back, so he's preparing for a second surgery. Let's take a look at this story first.
Musa tusanyise nnyo okusanga kati katwogere ku mboozi ya hernia. Hernia nno yatandika ddi era wasooka ddi otegeera nti olina hernia byagenda bitya?
Nze amannya gange nze Musa Weidi. Obulwadde buno bwa hernia bwatandika nga simanyi nti hernia. Kano katandika ano ng'ensanja bavu nga kalinga nga bw'olaba ino ensigo ya ffene. Ne kankwata wano bwe wati. Ne katandika okunnuma nga nzisa kumukumu omukka. Kumukumu bwenti. Ne ngenda mu kisenyi. Ne mbuulira omusawo akebera omusaayi. Ne mugamba ina akantu wano akannuma. Naye omukka nsika musike. Dokita n'angamba nti kano ka hernia. Naye yangu wojje ngutwale wali ku City Council y'omu Kisenyi. Ngenda kuwa dokita ayinza okujjako emitwalo nga 10 nga kakyali kato ku 15 akukoleko bulungi nnyo. Nzaawo nga sina sente. Akane kajjanga kanu nga kazima mpola mpola. Kwigamba ntandika okugula eddagala eryaba habo. Nga buli musawo gyensanga bana ab'ommotoka nga ngula. Buli gyensanga ngula bwenywa. Erimu nagulako neyo saidi z'entebe emitwalo 2. Nayo ne ndinywa. Erimu ne ndigulako ku saafi. Banguza kigaji. Naye nga bakifumba. Nakyo kwigamba yoyo yapeta simanyi busubiri. Nenywa. Naye nga nibwenywa nga teri njawulo. Nenga makoze ntya wano. Neeyongera ogula eddagala. Naye nga kisera bawonjawulo eriwo. Ekintu nekikuba n'omuwaatwa. Nekikkirira paka mu nsigo. Nembeera awo. Nkanamaanyi ganag'obutonde nga sikyagalina.
Wanywa habo for a very long time. Lwaki watya okugenda mu ddwaliro?
Anti nali ntya okunnongoosa. Ng'amanyi nti buli gye balonga n'akasonga katya. Era kyantwalira ebbanga ddene nnyo. Emyaka gyonna nga ndikutambulira mu ddagala eryo erya habo. Ng'amanyi nti linankolera. Era ekintu ekyo bwe kyali nga tekisobose. Ne ntandika ofuna omutima. Ne ngendako emulago. Ne nsanga dokita. Dokita kyanga mwena okujja n'emitwalo ameka? 4 oba 5 okulongoosa. Sente nga sizirinamu. Naye nga malaka nsooke nga bwe gyensangwa habo nga mbwira n'engula. Nenywa eddagala paka n'enkoowa. Kati ekintu kino nagenda olaba nga kitandise okutabuka. Nga kisse wansi nga mpanama. Naye ng'enkuba bw'ebanga etonnye nga ni mu nju ya siringi nga ntegeera ani yono omu nsigo ono atandikira akawano. Takolagana na nkuba. Awo sibitegeera nange sisi ngwetambula. Wakanga ngegenda mu saba singo bitegeera. Nembeera awo nenga makoze ntya. Ng'okulya sirya nnyo. Chai bwe nteekayo ekyokya mu lubuto kintu nga kikka wansi. Nengamba era ng'okulya nga neepimira kendya. Ng'obusulo bizito sisobola. Nenga makoze ntya wano. Nembeera awo bwe nengera okunywa eddagala. Kati awo nengamba bino ebintu byo bitabuse. Ayo eddagala nensooka ndivaako. Kale nengamba olumu ngenda evaamu nkole ki? Ngende mu ddwaliro oba banongoose.
Kati ng'ovudde ku habo, ng'okooye habo, osazeewo ogenda mu ddwaliro. Tunyumize ku mboozi yo eno eya operation, okulongoosa byagenda bitya?
Okusalawo ogenda mu ddwaliro. Nasalawo mu 21. nenga makanya nyala nfune eddwaliro nga sirya bbeeyi nnyo. Awo 2024 bwe nagendere wankulukuku nga mpera bino ebyakabaka bye balanga. Kati bwe nawulira nenga naye kange nengezeseeko ku bino ebyabakabaka bakala ki bye balanga. Bakanga ffe waffe Busoga tebiriiyo. Awo 2025 ogwo gwedde omwaka nenumbe wankulukuku omugwakubiri awo nembuuza abasawo konze bajjanjabira wa aniya ne bangamba gwe wa aniya leero tuli mu kujjanjaba ba aniya twagala bandwadde endala bya aniya biwanvumuko ne banagira omusajja nga mugamba butusi njeru kali omusajja oyo nemulumba nembuuza gye baliko ssebo ndikaina gye baliko nemugamba nkubulire bandagiridde gwe mwennyini mu okolagana naki n'abalali ba aniya nkoze ntya ndi bubi nfwa. Musajja n'agamba leka nkuwandiike nampandika nga nako n'abala bawandiise kamanyi nti byakusaaga nga muwe namba y'essimu eyange nemugamba mpaako ne kuyiyo namba agwe genda nze ngenda kukubira essimu nali ndi awo omusajja nga nkubirako nenga omusajja ono animba bulimbi oba nga mpulira ddala oba mufere nga n'abahabbo nabakoowa ate nga sina sente zakwejjanjabisa nga nkya n'akaso nenga maleka neeweeyo lumu musajja nga nkubira ngamba mu gw'omusanvu nti ye jangu kwerona nange nga nva eno mu gw'omusanvu azalina kuba 19 nga ngenda paka ku erona musajja nga musanga nga ngamba bine eddwaliro konzeye ngamba wano osasula sente za ddagala lyokka naye nga obujjanye bwaki bwabwereere.
Tunyumize ku mboozi eyo y'okulongoosa byagenda bitya ate bani abakolako wawulira otya wali otidde oba wasigayo oli strong?
Kati fwe abaali obubi ennyo fwe basookerako ku Mmande eyange yali aku Mmande ssaawa zaali nga 4 awo nga bamaze okutwambaza kuno twambala ne bantwala munda nga batwala abantu bameka basatu Baspain baali 9 kati nga nowa wano nga akubeerako dokito omu nga naye nga wakuna nga bakuba wana akayiso wano mu mugongo wa ng'okutamya mu booti bwe baba nga bamaze okulongoosa nga bantese ku kitanda kyange awo nagenda okwekwatako bwe nti nga omubiri nga gulinga ogutali gwange nga kiringa ekiti era batugamba nti amasanza awo natandika gagenda nga gagwamu mu mpalampala mu mubiri kati bwe natuuka ewaka balugamba nti okuli osigala ng'olyanga bulijjo naye nga tolya nnyo ate kusukka chapati ngezi tozirya ebintu ebikaluba bwe bityo okunaaba wano nga bagamba nti toyisawo mazzi okumala bangamba ako nga bbiri nga siyisawo mazzi era nga n'ekino nga bwe kiri naye ate nze kyandwala okumala kumpi mwezi mulamba nga siyisawo mazzi nga ntya nikiyinza okugamulukuka kati ate obuzibu namala nensangamu ekintu kino kyama nekiika wansi bwe kiika wansi bwekiti mu nsigo nenzirayo nemagamba ekintu ate kyasse wansi nkoze ntya kitontono nga kiringa katunda dokita nagamba ogwo musaayi gwesengezze naye gugenda kukola ki gugenda kukala ng'omaze amakerenda era amakena nagamalawo nga tegukazze kali nekulako bannange essimu ne mbabuuza nti namwe kino kyabazimba nga nze ne bangamba kyaluzima ne tuddayo ne batusikamu ki omusaayi ogwo ate nze saddayo naye kati tekyakala kigenda kikala mpolampola era kati weekali katontono nga si kamaanyi nnyo nga luli omusaayi ogwo.
Wayise ebbanga ki nga bakakulongosa?
Banongosa gwa 10 ng'enaku 21 teeza waba nkayita myezi nga 3 kati obulamu bwange ejje bwakyuka mu ssaawa zino siri bubi nga luli kali nsobola okutambula bulungi nnyo wano guwatereera era walamu nnyo tewali buzibu era n'ebizito byo era nsitula era kati sitya nagenda kulongoosa aniya lwaka nti eri ate eya kana akali eno kojje kali we buzibu bweyina nawo katandisa ate okola ki okukka
olowooza ekomawo
kasigalamu ndowooza tebaakalaba kali ku sayidi eno
balaga side eno
nabalaga sayidi zeeno
yeah
kati oyosa akeno kali kato nnyo kati ate ngenza okukalaba luvannyuma kano sayini yaako ndala ku kiri ekyasooka kano kookyeranga ng'omuliro kookyera ng'omuliro ak'esayidi eno naye nga bwekakwatako bwoti kakyali katini
kale Musa tweyanziza webale nnyo tunyumize mboozi yo ya Hernia tukwagaliza ebirungi.
Once again, you are welcome to NTV Medical Matters. My name is Viola Kusasia, and we are supported by Bill and Melinda Gates Foundation. What you just watched right there is the gentleman Musa's story about his journey with Hernia. In fact, it has come back, and so we are here to decode all of that. What is happening? Why does he have a second one? And why hasn't the last one healed? But also to look at the causes and the people that are at high risk. Plus, why is it more common in men as compared to women? So you are welcome, and our doctor is in studio. Dr. Odongo James, and he's a general surgeon and urologist. You are welcome, doctor. And first and foremost, we are going to just start off with hernia. In simple terms, what is hernia, and also what are some of the causes of hernia?
Yes, hernia is an abnormal protrusion of an internal organ or a tissue from inside to the outside, from a cavity where it usually stays. For example, the abdomen, inside there is a cavity called abdominal cavity. Inside that cavity, we have organs, we have structures. For example, the intestine is inside. Now, once the intestines begin coming out through a weak spot, that becomes hernia. And in the body, there are natural weak spots. For example, the groin, there is a natural weak spot, there is a natural opening in the groin called inguinal canal. Now that opening is a weak spot already. So if the intestines protrude or exit through that weak spot, that is called hernia.
I will ask you a question. Why is that cavity or canal there? What is its purpose? Because it's a weak spot.
That canal in the man, it transmits the spermatic cord. Because in a man, the spermatic cord is important. And it communicates to the outside through that weak spot, to the scrotum. Because the testis resides outside. So there should be a communication.
I see.
Even in the women, that communication is there, but it carries a ligament between the uterus to the outside. So it's a natural opening that someone is born with, but it serves as a weak spot through which hernias occur. In the men, that weak spot is wider. That's why you see it happening more commonly in men. In women, that canal is smaller. So we see the hernias in women less than because that opening is smaller in women. And again, in men, we see it more common on the right side because the right side develops later in life than after the right side has already developed, the left side develops later. Yeah. So the opening is more pronounced and stays on the right side, and the hernias more likely happen on the right side.
So let's look at the causes. Regardless of the fact that it's common in men, some of the people that I've talked to attribute it to heavy lifting, but is that truly the cause?
Yes, heavy lifting. Now, any activity that will increase the pressure inside the abdominal cavity will cause hernia. Heavy lifting increases the pressure within the abdomen. We call it intra-abdominal pressure. This intra-abdominal pressure, once it is increased, it tends to push out the intestines and other structures within the abdomen. causing hernia. Now that hernia will look like, it will appear as a bulge, a swelling in the groin. Of course, they call it groin because the swelling is within the groin. That's why they call it groin hernia. But hernias can be elsewhere in the body. But the one in the groin is the most common. And in surgery, we call it inguinal hernia. But for the people to understand, we always say groin hernia. But in surgery, it's better called inguinal hernia. Because in anatomy, the name of that area, the groin, can also be called inguinal. So the name becomes inguinal hernia. So the name of the hernia always comes from the location of the swelling that comes out of that hernia. For example, if it is in the umbilical area, like we saw in the previous diagram, we call it umbilical hernia. If it is in the femoral area, we call it femoral hernia. But the most common is the inguinal hernia. Over 75% of hernias occur in the inguinal region. That's why we call it inguinal hernia.
I was just thinking to myself, you know, for example, the men who go out to the gym, men who do very heavy work, but what are some of those activities that men should stay away from that are watching right now and could be at risk?
Heavy lifting is one we have already mentioned, and any other conditions that can cause someone to strain, like constipation. You find there are people who are constipated. When they go to the toilet, they strain to push stool out. Coughing, which is chronic. You're always coughing, chronic cough causes herniation. Then there are people who are born with, we call it connective tissue disorders. Their tissues are weak. You find someone is born but has that disorder. You are born with weak tissues. Your abdominal wall is weak, and that's how you are born. And that disorder comes from the beginning, from childhood, and you find the weakness is even more pronounced in these people. So they tend to develop hernias more. Obesity. You know, obesity, we say obesity, these are fat people. It means their body mass index is more than 30 and above. When there's a lot of fat in the body, the pressure within the abdomen increases, and this pushes the contents outside in form of hernias. So being fat alone is not good, so it's good to maintain your normal weight. It's a risk when you're fat. Smoking is another risk. So it's good to keep fit, so that you don't develop these hernias. But the main thing we see always is heavy lifting, like the casual laborers whose occupation involves lifting heavy weights. Those ones are even at a higher risk of developing hernias. People who work hard in factories, lifting heavy weights, and people with chronic diseases that involve straining when you're passing urine, like men with prostate disease. They strain a lot when passing urine. Now, such men at a higher risk because they are straining all the time. They are straining to pass urine, so they develop hernias.
Is there a way that you can carry heavy weight without? Is there a certain position that you can use in order to carry heavy weight without exerting that pressure on parts that could come out?
Yeah, there are ways, but again, there are abdominal binders people always use. You put it's like a belt to support those weak areas. When you're lifting, you can support the using abdominal binders. They are special belts, so I can call it a belt for easy for the purpose of discussion. You wear it, and when you're carrying it, supports your abdominal wall.
What is the difference between what is the difference between hernia and hemorrhoids?
Hernia is a protrusion. It means the internal organ has exited through a weak point to the outside. But hemorrhoid is a swollen blood vessel. It's always within the anal canal, the anal opening. It's usually a blood vessel that swells and prolapses outside. But hernia, it is the internal organ that protrudes to the outside. It may not be a blood vessel. Heme, when you say heme, that's a blood vessel. So that's the difference.
Okay, are there symptoms that are so different between how to identify hernia very early within women, also within men?
Yes, symptoms are there. These hernias, the most common that we see, you will always see a swelling, a bulk. You will see a swelling. This swelling may be painful or may be painless. So, for example, if the hernia is complicated and it is obstructed.
So are those the examples?
That swelling, okay. You see in that picture. You find the viscera, you see it's part in that diagram, there is a part of intestine which is protruding to the outside. Yes. Now, if that part of intestine is trapped within that swelling, you start feeling pain, you start vomiting, you start feeling like you want to vomit, you feel like you are weak. So that's a complicated hernias. And it becomes even discomfort when you cough, when you strain, the pain worsens. Yeah. And when you lie down, the pain reduces. For example, you've been walking the whole day, doing your work, the pain worsens. But when you get back home and you lie, you sit, you lie in your bed, the pain reduces. Now that is typical of an hernia which is already complicated and needs surgery. But there are hernias which are small, which may not have symptoms. It has just begun. The hernia is 1 centimeter less. The defect, the opening through which the hernia is protruding is less than, for example, 1 centimeter. It's not causing symptoms. Yeah. You may have just like a small piece of tissue coming through that opening. It may be asymptomatic and small hernia. So those ones may not need surgery immediately. So
speaking about the small ones, do they actually do they go back at a point, or are they reversible?
Yes, hernias which are not complicated reduce back, especially when you apply gentle pressure over the swelling. It reduces back into the cavity of the abdomen, and it may not be painful. Now, such hernias are the uncomplicated hernias. They are reducible. Sometimes we call them reducible hernias. Then the hernias which are irreducible, obstructed. Now, those are the complicated forms. Irreducible, painful, obstructed, strangulated hernia. Those are our terms now. It means the hernia contents of the sac. You know, hernia has a sac. I think I should have said that earlier. There is a defect. That is the opening through which the viscera protrudes or the tissues protrude. Then there is a sac, it forms. Now that sac has a neck, there is a body, there is a fundus. Now the neck of the sac will determine whether this hernia is going to be complicated or not. When the neck is wide, it's less likely to obstruct. The neck, that picture, you see? That's what I wanted to show. I don't have a pointer. But the other small opening, that is the hernia defect. Now, where that opening is, we call it the neck of the hernia. Then this part is the body. Then this extreme end is called the fundus. So once the neck is wide, that hernia will remain reducible and may not obstruct and may not cause a lot of pain. But when the neck is narrow, small, it causes pain and may not reduce. When this protrudes outside, the intestines protrude outside, for example, they may not go back easily and to obstruct, it will refuse to go back. Even if you push it back, it doesn't go and causes a lot of pain.
Is that what you call strangulation?
Yes, strangulation.
So it's literally getting, the intestine is getting strangled.
It's strangulated, it's strangled. Even the blood vessels will be cut off, the blood supply will be compromised. I can see. So the intestines will be strangled there, causing a lot of pain and sickness, and even it can give way, because if blood supply is cut off from that area of the intestine, it will perforate, it makes a hole there, and that makes it very complicated hernia, and that's how hernia kills. If nothing is done, nothing. The patient is left without surgery.
So, doctor, can you explain that in Luganda for our audience? Okay, it's okay, all right. But I hope that from Musa's story, that was something that was quite obvious, that his stage had gone way, way beyond. In fact, he spoke about the fact that he got a surgery, but he has a bit of another sac. Now, this time round, this sac contains blood.
Yes.
So how is that going to work out for Musa?
So his hernia is now the complicated type. And once hernia is complicated, then the treatment becomes surgery. Now herbs may not help there.
Okay, by the way, the conversation, doctor, is going to go back to the usage of herbs. You know, Musa used a lot of, I can't even explain. He spent a very long time using herbal medicine and quite honestly never helped out. So we need to talk about the usage of herbal medicine, but we shall do that after this break. Welcome back from the break, and thank you so much for staying with us here on NTV Medical Matters. My name is Viola Kusasira. We are supported by Bill and Melinda Gates Foundation, and in studio with us this morning we have Dr. James Odongo, and he's a urologist as well as a general surgeon. So we are discussing hernia, what causes it and how can it be avoided, but also reversed in case you've had a case already. We watched a story about Musa, who suffered 2 cases and is awaiting surgery. But Musa was taking a lot of herbal medicine, doctor. So where could have things gone wrong for Musa? I just feel personally that he took a very long time, and he tells me he was very scared of the surgery. So could you please address that case?
Yeah, so hernia itself is a surgical problem and is treated through surgery. Because if you talk of herbal and surgery, surgical diseases, surgical illnesses should always be treated through surgery. Now, if you take the example of hernia, when you get hernia, the best thing to do is to go for surgery. If you delay with it, like I said earlier on, it becomes complicated. It becomes obstructed, like I explained the other time. It stops going back. Because the uncomplicated forms of hernias, when they happen, they protrude but can be reduced back without causing pain.
Yeah.
Now, when you delay with it, it will protrude outside but can't be reduced inside. It can't go back.
How do you determine that this one might be the complicated or the simple type?
By physical examination. Because when you examine physically, the hernia is reducible. The hernia may be irreducible. Then you also ask the patient to cough in the clinical room. Now, when they cough, you see the protrusion or the bulk increasing in size. We call that positive coughing pulse. When they cough, the protrusion or the swelling increases. Now that one is not likely to be complicated, and it goes back on its own. It reduces back. But there are these forms of hernias that can't reduce. They come out but can't reduce and go back inside. And they are very painful. When you touch, it's tender. We call it tenderness in surgery. So when you touch, the patient screams. That is likely to be complicated. And again, it causes a lot of pain and vomiting. By the time they start vomiting, they fail to pass stool, you go to the toilet, you take so many days. It means the intestines within the contents of the sac, they are obstructed, and the patient is now very sick. Clinically, they look very sick. Even their appearance, they look sick, they are disturbed, they are in pain. Then you know that they have complicated hernia. Whereas there are these patients who don't look sick. They can even work with their hernias. Those ones, they're uncomplicated forms. And you may even take longer to do surgery in such patients. So hernias, when left like that without treatment, they definitely become complicated. The swelling keeps increasing. The defect of the hernia keeps widening and becoming big. And over time, they become trapped within the swelling. So those contents are trapped within the swelling, and that will cause a lot of pain. It can even cause death. I think that's how the hernias kill And even Musa is saying he was bleeding because the swelling is trapped and it can't reduce. So they start bleeding, the intestines will die within the sac. Now, once the intestines die within the sac, you lose the patient. That's what happened.
So for Musa's case, he's undergone surgery, but he has that blood that is still trapped in there. What will happen to that? He actually asked that question.
Musa, I think his surgery is recent. He had the surgery last month, I think towards
the end of the year.
Towards the end of the year. He's still healing. Should be healing. And it needs to come for assessment, and we see whether the surgery went on well. It needs a clinical assessment. I think I'll be willing to offer that. I think I can examine him.
Let's actually listen to Musa. He had those questions somewhere, so we have him on video. He's able to ask.
Nze nga nze byembuuza musawo ekintu kino ekiri omudokita kyangamba nti musaayi kyo omukendera yakyo ntono kati mba njagala nyinyonyole nkoze ntya ate kimala nekyokkerera ne kisiiwa kati awo simanyi kikyenazzaako kigenda kuggwamu oba kyetaagisa kuddayo kukirongoosa ate n'ekirala ani yono bwebanga banongosa kati nga mugo 10 nsobola okuddayo mu gwokuna ne banongosa oba banga kiri empisaawo ogenda okunongoosa.
So, Doctor, that is Musa, and he has two questions actually. The first question is about the reduction of that blood sac. How long will it take to go back to reduce his own medication? But he also speaks about the fact that he has a second hernia on the opposite side, and in how long can he go for another surgery after the recent one he had in October of 2025?
So, what he needs to do is to wait for this side they operated to heal. Healing always takes around 6 weeks to 3 months. Let him wait. Once he has healed and he doesn't feel pain on the right side, then we can go and operate the other side. But again, it depends on how complicated the other side is, the opposite side. Is it paining him? Is it reducible? Can it be reduced? Or it's irreducible? So we need to assess him again. So which means he needs to go to the hospital, he needs to see a surgeon to assess how complicated the new hernia looks like. Because if it is very complicated, we have to do it. It becomes an emergency. Yeah. You have to operate there and then. But if it is still small, not causing symptoms, and it is reducible, it can give him time to heal. The right side to heal, then we can operate the left side. But if the left side is already complex, causing a lot of pain and is irreducible, then we have to do the surgery. He has to go in.
He has actually expressed the concerns around his lifestyle. He was forced to go back to work because he does not have a lot of people to assist him. So could that actually speed up how then the other hernia gets worse?
Yes, it can speed up. Because what we always advise when you have hernia is to keep away from activities that will increase the intra-abdominal pressure. So such activities like lifting, walking, you should reduce them so that the other side does not worsen. So we need to keep away from those activities until we can have surgery.
And doctor, let's talk about the babies or younger people or younger ones. Have you come across cases where you have hernia in babies?
Yes.
And how can that be handled?
Yeah, hernias in babies. You know, when a fetus is developing in the uterus, the testes develop high up. So this testis descends to the scrotum as the baby develops. Now, by the time the baby is born, the testis will be found in the scrotum. So the path of testicular descent always remains open in some children. The testis descends, but the path does not close. Now that path remains open. Now that opening is a path for another hernia to form. And that's what happens in children. Children are born, but the path of testicular descent, we call it processus vaginalis in our language. The processus vaginalis remains open. And in our language, we call it patent processus vaginalis. It remains open and it communicates to the outside. Now, that opening forms a path for the internal organs to pass through and exit to the outside from inside. Yeah. So that's how hernias in children form, because the processus vaginalis has refused to close. The processus vaginalis is still open because ideally in a normal child, the processus vaginalis should close. By the time the child is born, it is closed. But if it remains open, the child develops hernia, and they are born with it. So they come to hospital with the swelling, also in the inguinal region. We call it inguinal hernia in children. Even less than 1 year you see it, and can be treated through surgery. These hernias can be treated, even in the babies. So, you see the diagram, inguinal hernia, we see them in babies, even umbilical hernia. You see that umbilical hernia. Umbilical scar is a point of weakness. Everyone is born with this scar.
I've actually seen that before. I've come across that where it's like the umbilical cord sort of comes out.
It comes out because this scar is what? A point of weakness. Okay. It's a weak area. So the intestines inside the abdominal cavity can come out through that, forming what we call umbilical hernia. Yeah. Now there is incisional hernia that comes out through a point where surgery was done before. It comes through a scar. A scar naturally is weak.
Can that happen for a C-section?
Yes, C-section. You can get incisional hernia after C-section. Epigastric hernia, the same. So the name of the hernia depends on where they are, where the swelling is. So when the swelling is in the umbilical area, you call it umbilical hernia. Yeah. When the swelling is in the epigastrium, that upper part of the abdomen is called epigastric hernia, and so on and so forth. It depends on where the swelling is located, the name of the hernia. But the most common is inguinal hernia. That's why when they say hernia, it is inguinal hernia, because it is the most common type we see in the hospital.
Okay, I'll just take this moment, to let our viewers know that you can actually call in if you're watching and you have a question that is pressing. Our doctor is still here, so feel free to call in and ask him the question directly. You can also go to our social media at NTV Uganda and be a part of this discussion. But doctor, how much role does the type of diet somebody is on create, an impact or affect how then they what can I say? How they deal with that?
That is important. There are diets that predispose you to constipation, because earlier on we said constipation is a risk for hernia formation. Now, diets that do not contain fiber, for example, you are eating a diet which has no green vegetables, for example, you're not drinking water and you have constipation, all the time you're constipated, you push, you strain while passing stool, you're likely to get hernia. So any diet that causes constipation should be avoided. Any diet that causes obesity, we discussed earlier on, when you're obese, you are likely to develop hernias. And even after surgery, your hernia is likely to recur, because what causes the hernia has not been addressed. So when you're treating these patients with hernia, even the risk factors should be addressed. And when you're assessing them, you assess the risk factors. Why did the hernia come about? So that should be addressed, because even if you repair, even if you do surgery, they will develop it again. So the risk factors should be addressed. If the patient is obese, you ask them to lose weight. If they have constipation, you ask them to address constipation. If they are lifting, these workers who lift a lot, you ask them to reduce it, or to swap duties with people with no hernia. So that's what we always do. You treat the risk factors, but you also do the surgery to repair the hernia.
Is it advisable for somebody to live with an hernia if it's not painful, the smaller type?
Yes, you can live with hernia when it is symptomatic, but you need to be followed closely because with the time they develop symptoms. So it's not like you live with it forever. With the time they develop symptoms, with the time the swelling becomes bigger and worsens.
A very important question here, Doctor, for the men that are watching and might be wondering, does hernia then affect a male's productivity or fertility?
Yes, if it is left and you can lose your testes. Because one of the complications of hernia repair is inguinal pain. You do the surgery, but the patient continues feeling pain in the inguinal region. You do surgery, but you injure the nerves. There are nerves that pass through the groin. So they should not delay with the hernia, because if you delay with hernia, any of those can happen. So once you have hernia, once you develop hernia, you should come for surgery. I think that's the best message I can give men, because it can affect the fertility, because the testes, they are near there. And even the surgery, if it is too complicated, can affect.
Speaking about the complication of the surgery, Musa expressed fear, and that was the reason as to why he actually depended on herbal medicine for so long. He was very scared of the surgery. What message can you give to our viewers about the surgery in case they really have to go for it and that's the last option?
Surgery, if you're to do surgery, it's good you come when the hernia is still not complex. If you come for surgery late, then the surgery becomes more. You see, even malaria, if you delay with it, it can kill you. Now, the same applies to surgery. If you are to come for surgery, then you come quickly. You don't delay with the herbs, because I said hernia is surgical. Hernia is surgical. So if it's a surgical illness, then it means you have to come for surgery promptly. You don't delay. You don't delay. So come for surgery quickly, and when you do this surgery promptly in time, you are not likely to have complications, like when you delay with the surgery. So that's what I would give men. They come promptly. They come to hospital quickly when they have the hernia.
In how long does the hernia become very dangerous between the time of the onset and to where then you say, this is a very complex case?
Now, hernias, it depends on its location also. There are hernias which are really dangerous. For example, femoral hernia. Femoral hernia, that's another term I've introduced. We see it most commonly in women. I said earlier on that women, the canal, that inguinal canal, is smaller. And even there's another canal below there called the femoral canal. It's another natural opening in women. Now, femoral hernias are dangerous from the word go.
Why are there these canals? What is the purpose?
The purpose? It's just communication in the body.
I was imagining we could get rid of them so that we can save ourselves from getting them.
Now, it depends on the type of hernia. If you get a femoral hernia, it's dangerous from the word go. I can't even say, you first wait.
How can we avoid it? How can we avoid it apart from avoiding heavy lifting?
It's the same, heavy lifting,
okay, cool.
And even pregnancies, you find their mothers who have carried multiple pregnancies and they have weakness in the pelvis already. So, heavy lifting, obesity, it's the same. Now, that question depends on the type of hernia. But for example, femoral hernia, once you have it, I advise you to go to hospital immediately. You just present yourself there because it's a dangerous type of hernia. But inguinal hernias, which are reducible, you can delay a bit. But again, you should observe for the symptoms if they are worsening. So once you see symptoms worsening, irrespective of the time duration, you present yourself to the hospital. Because you can develop hernia today, then after 1 month, the symptoms worsen. You have to present to the hospital. Whereas another person can develop hernia today, and they have to go to hospital immediately.
I noticed that there is research, pointing to the fact that the hernias always return regardless of how many surgeries you have. What are some of the ways that a patient can take care of themselves after the first surgery in order not to have a second hernia?
Now, after the first surgery, a patient should first heal. What I would encourage them, after the surgery, you wait until the body has healed before you return to work. You wait until the pain has gone. Because after surgery, the body has to heal. There are people who go to work immediately after the surgery. They're already doing their work. Now, that becomes difficult in our setting, in a setting where the patient has no social support, the patient has no attendant, and is the breadwinner. But ideally, after surgery, you wait until the body has healed. And again, they need to go to a competent surgeon to do the surgery. Because these days there are so many things going on. Everyone wants to operate. They need to look for a surgeon who can operate well with the basic surgical skills to do the surgery. So which means we need to develop that surgical capacity.
Musa talked about the fact that he could not afford surgery, and actually that's really one of the reasons why he opted for herbal medicine, apart from the fear. And he also said that he got lucky. He was pointed somewhere to go and have a free surgery. So for people who can't afford surgery or who don't understand anything to do with surgery, how can you advise them?
I think that means we need to sensitize the communities. People are not aware that hernia exists. And also government. We need to invest in the health center force. This country we have health center force. In the villages deep. And the problem of hernias, we always see it in the villages. Now the health center force, we need to equip them. And we need to train more doctors, even the general doctors. If we can train them how to repair these hernias, it will be, the services will be more accessible. We need to take the services closer to the people. Now that involves government coming in to equip the hospitals, to equip the health centers in the villages so that people can access hernia surgery. But again, I would advise, look for a hospital where you can be operated. The health center force are now available. I think what government is doing, every constituency is now called a health sub-district. Everywhere there is a constituency. Now in each health sub-district there is a health center for. Now in those health center fours we have doctors. Now we just need to equip them with the skills necessary to repair these hernias so that the services are closer to the people. Because hernia is the most common surgical condition that you can see. Even when you go to the village, you find hernias. Every man hernia, hernia, hernia. Hernia is so common. And we can't run away from it. So my appeal to government is to equip the health center force and deploy doctors there.
When you look at hernia in men and the fact that we can't run away from it, that you've mentioned, I can imagine a lot of our men are worried now. But how connected is hernia with some of the prostate problems we get to see?
Yes, men with prostate, they always strain to pass urine. Because when you have a prostate disease, urine does not flow. Maybe we could have another diagram. But prostate sits where urine comes through. So when the prostate enlarges, urine stops flowing out. So for you to pass out urine, you have to strain. To strain. Each time you're passing urine, you're straining. Now that predisposes you to herniation. The hernia forms. Each time you strain, it will come out. Each time you strain. So men with prostate disease develop hernias because of chronic straining while passing urine.
And so let's also look at some of the common myths or misconceptions about hernia that you've come across in your practice that you'd like to bust today. What are some of those myths?
Of course, people always attribute hernias to witchcraft in our setting. They will tell you how hernia is common in certain groups of people. But again, it is not about that. Hernias are common in men. By the way, if you look at the epidemiology, we see hernias in children, like I said, less than 1 year. And the prevalence keeps increasing with age. Prevalence is how many do we have? How many hernias do we have? So as someone grows, now when they reach 50, you find the hernias becoming more common because the muscles are now becoming weak, the abdominal muscles are becoming weak, so the hernia can easily form in such people. With age, the prevalence increases above 50 years. So it's not about witchcraft, it's not about tribe, it's not about gender or religion, it's about the person himself. Does he have the risk factors for hernia formation? If they have, then we need to follow them closely. I think that's what plays a big role in hernia formation.
And looking a little bit more about the surgery, there is one that I've come across where they use mesh. How safe is that, but also how can you talk about the safety versus the risks?
Yeah, now that is the technical part now. How do you repair hernia? The mesh is the gold standard. We call it gold standard. Why? Because it is the best technique of hernia repair. It has no problem. It doesn't cause any issues, and that's what we advocate for. But it's not common to have a mesh. Those meshes are expensive. But that is the best because, one, it doesn't cause tension. The diagram is there. When you put it there, it does not cause tension. It occludes the defect without causing tension around the surrounding tissues. And the recurrence rates are less with the meshes. Because when you put a mesh, the risk of the hernia coming back is less. It doesn't recur. So that's why we prefer the mesh repair these days, because of the low recurrence rates and because of the less pain that comes after the surgery. Because techniques that cause tension around after surgery always brings pain. You've done the surgery, but the patient still says, I'm feeling pain. Musa, I'm feeling pain. That does not happen with the mesh. That's why we prefer the mesh. Though it's expensive, not everybody can afford it. And government may need to pick interest in this, can pick interest in supplying meshes to the hospital. But of course, there are other techniques of hernia repair, but they are inferior to the mesh. The mesh repair remains the topmost, remains the gold standard technique of repair for hernias. And this is what I would go for as a person.
That mesh reminds me of a mosquito net. And I'm wondering, where does that mesh go afterwards? Does it dissolve within the body? Does it stay like that?
Yeah, there are meshes which dissolve, like the one we use in the children to dissolve because children are still growing.
Yes, it dissolves.
Then there are those that remain, but they don't cause any issues to the tissue.
Is it very soft? It looks like an iron sheet.
Yeah, it is soft and tissue friendly. It's like a mosquito net, you said. But it's not the same material from the mosquito. It has a different material from the mosquito net. Okay,
thank you so much, Doctor, for your wonderful insights about hernia today. And I really hope that our male audience especially have picked what they had to pick in order to stay safe. So I'll ask for your final remarks as well as your contact if you'd love to share with our viewers.
Yeah, so hernia is real. I think it is the most common surgical illness, general surgical illness we see in our setting. And I would like to encourage men who have hernias to go to hospital. You should not waste time with herbs. Herbs don't heal surgical illnesses. They don't. Surgical illnesses are healed by surgery. That's why they say surgical, because you heal it through operation. So when you have a surgical problem, you have to go to hospital. You can contact me. I'm also available. I can help. I'm available at Jaro Hospital, Namugongo. Namugongo is known for that shrine. I am near the shrine. The Catholic shrine is known. So you come to Jaro Hospital. I'm always available. So those who want to take my number, it is 0774 06 46 53. And I want to thank the audience for listening. I want to thank the Jaro Hospital team for the work they are doing. And we are going to help people with hernias in Namugongo, in the whole country.
Thank you
We're
so
available.
much. Thank you so much, Doctor. And we have to also thank NTV Uganda, obviously, for for letting this information get out to you, dear viewers. Thank you too, viewer, for being here and listening to this talk about hernia. So if you're struggling with the same, you know exactly where to go. If you missed the episode or weren't able to catch the number, you will catch this episode on our YouTube, NTV Uganda. I am Viola Xasira. This is NTV Medical Matters. We are supported by Bill and Melinda Gates Foundation. We wish you a very fruitful week, and we shall see you on the next episode.